Dr. Simon Zeisman, Employee Assistance Resource Services, Incorporated. Doctor, thank you for joining us.
Good afternoon, Senators. I'm Dr. Simon Zeisman. I'm President and founder of Employee Assistance Resource Services, acronym is EARS, located in Smithtown, New York. EARS is an OASIS licensed medically supervised program with ancillary withdrawal services licensed since May of '86. I will be presenting about the benefits of outpatient ambulatory detoxification treatment for patients suffering with the disease of opiate addiction and the role that it can play in dealing with the current heroin epidemic. When an opiate-addicted patient is discharged from inpatient detox after 3 to 5 days, they're still in moderate to mild withdrawal and at high risk of relapse because opiate detox without medication takes 4 to 6 weeks. In order to prevent relapse, the patient needs to be immediately referred and admitted to an ambulatory detox program such as EARS. Ambulatory detoxification programs have the ability to expand and contract in order to meet the growing demands of the current heroin epidemic. Approximately 60% of patients in moderate withdrawal currently are admitted for inpatient detox treatment. However, these patients in moderate withdrawal can be successfully treated in an ambulatory detox program without ever having to go inpatient. This results in dramatic reduction in cost. Ambulatory detox allows the patient to live at home and to continue working with minimal disruption to their activities of daily living. Medication-assisted treatment is a big part of the service that we provide. Buprenorphine is frequently used to treat opiate addiction in the EARS program for the following reasons: to treat mild and moderate withdrawal symptoms, stabilize mood for patients suffering from dopamine deficiency syndrome, reduces cravings for opiates, prevents relapse, increases energy, reduces mild to moderate pain from withdrawals, fills the void produced by dopamine deficiency syndrome, reduces suicidal thoughts and suicide attempts due to dopamine deficiency syndrome. It also allows the patient to resume relatively normal functioning at home and at work. The following is a testimonial from a patient describing his ambulatory detox treatment experience at EARS over a period of 3 weeks. Quote, "Over the last month, I've been going through a major transition, both physically and mentally. Last month, I was a slave to Vicodin. Everything I had planned, thought of, and my daily activities revolved around whether or not I had Vicodin pills. Even my dreams had pills in them. Now I feel free of this. Vicodin is no longer part of my life. I'm not scared of running out of Vicodin pills. My life has changed drastically. I feel great. I'm not tired. I look forward to the rest of my day. I have already completed many projects that I indefinitely put on hold. I look forward to tomorrow. I feel like I've been reborn." These are comments by me. While under the influence of opiate pills, this patient found himself getting more addicted and out of control. His entire existence revolved around drug-seeking behavior from the time he woke up in the morning till the time he went to bed. With the help of treatment, he has regained self-control. He no longer feels like a slave to his drug. Now when he gets up in the morning, his primary preoccupation is, what am I going to have for breakfast? Drugs no longer control and dominate his life. The change in him is easily noticeable to anyone who knows him, cares about him. That includes people who knew about his opiate addiction, his wife and parents, as well as people who were not aware of his addiction. He's no longer experiencing the following symptoms: elevated pulse, chills and flushing, excessive sweating, restlessness, pain in bones and joints, nose running, eyes tearing, vomiting, diarrhea, nausea, tremor, stomach cramps, yawning, irritability, and goose flesh. He is now able to function like a relatively normal human being and is being more productive in the workplace and at home. Government regulations currently limit the number of patients that an MD can treat. For example, 30 patients per month for the first year, and 100 patients per month subsequently with buprenorphine, also known as Suboxone. But government regulations do not restrict the number of patients that an MD can treat with opiates. This policy limits the number of patients that can be treated in outpatient treatment for opiates. This also limits our ability to deal with the current heroin epidemic. This government policy, or limiting the number of patients that an MD can treat with buprenorphine, needs to be corrected as soon as possible, as this heroin epidemic continues to escalate out of control. I want to thank you for allowing me to present at this very important task force.
Thank you very much, Doctor. The next is John Javis from the Advanced Health Network. And we have 2 speakers left.
All right, so good afternoon. So the Advanced Health Network represents 20 behavioral health providers on Long Island and New York City. In addition to my professional role here today, I can also share with you personally that due to opioids and other behavioral health issues, that my wife and I have found ourselves in a rather unexpected position of raising my wife's 5-year-old granddaughter, my step-granddaughter, in our home for most of our life. As we have borne the financial and emotional costs of providing a loving home to this child in spite of the danger, dysfunction, chaos, and trauma caused by opioids and behavioral health issues. All of you know that New York State has embarked on a very aggressive campaign to reduce Medicaid spending by reducing emergency room use and by reducing hospitalizations. And I am not exaggerating when I say that the opioid crisis, which obviously tends to increase ER use and hospital use, has the potential to cause these efforts to fail. And the governor and DOH and insurance companies need to hear that very clearly. So we make 4 recommendations. The first involves, and several people today have spoken about, the need for insurers to ensure an adequate length of stay. We're actually doing some of this work. We have a transition care project that helps people engage in treatment following hospital discharge. These are folks that tend to have substance use, behavioral health issues, and most often brought to the hospital for an intentional suicide attempt using opioids or heroin. We're seeing people discharged prematurely. They're still craving substances, still experiencing mental health symptoms, and very often discharged homeless. These folks go right back to using. They wind up back in the hospital and are readmitted. You should also be aware that in New York City, when someone is admitted to a facility for a substance use issue and they're discharged, in 40% of the cases, they're right back in the hospital within a month. So a 40% readmission rate in New York City. The second involves substance use housing, and again, several speakers today have mentioned that. OASIS and New York State need to invest in a system of tiered housing, similar to what's offered by the New York State Office of Mental Health. While this format of housing can be rather expensive, when you look at the overall cost to taxpayers in terms of services, hospital use, emergency personnel, incarceration, law enforcement, providing decent housing would actually lower those costs. The third involves peer support. As New York State increases funding for opioid treatment, we strongly feel that peer support should be a strong component of that, and I think that County Executive Ballone mentioned peer support as well. I was personally involved in starting in New York State and Long Island the PFC Dwyer project to provide vet-to-vet peer support. We know that peer support works with various populations. It reduces health costs, and we think that that should be a priority. And the fourth involves abuse-deterrent opioids. We strongly support efforts by the CDC to limit the amount of opioids that are prescribed in the first place, all right, and to educate prescribers and to actually see addiction as a side effect that is less desirable, right, than the pain itself. And as Jeff Reynolds mentioned, if someone goes to the dentist, maybe they get a 2-day supply of opioids, not 30 with 2 refills. And if those opioids are prescribed, we do support the passage of New York State abuse-deterrent opioid bill, sponsored by Senator Hannan. So if we're able to reduce the amount of opioids prescribed and make those that are prescribed tamper-proof, we think that's another tool to help this effort. Thank you.
Thank you very much, Mr. Javis. Mr. Nick Van Breda from Washington Heights Corner Project.
Thanks for having me, guys. To be perfectly honest, I wasn't expecting to speak today. I was told that there was no room for me, but so you'll have to forgive my lack of preparedness. What I will say, though, is we've talked about treatment and access to treatment. I've worked with people who use heroin and other opiates for about 13 years, and this has ranged from working with school kids to, people to elderly people. And one thing that I can say is that the road to treatment is a very long one, and sometimes it takes, many times to, going into rehab, out of rehab. I don't see a failed rehab attempt as a failure at all. It's actually one step closer to someone, becoming, fully recovered. And it's what we do in the time between someone, someone's addiction and someone getting rid of it, that the real work needs to be done. And I work at a needle exchange in northern Manhattan, in Washington Heights, and every day I see people who use heroin, and many times we try and get people into treatment, they can't get there. Someone mentioned it before, with injecting drug use, which is what people who start taking opiate pills often eventually end up doing, is injecting those drugs. And if people don't have access to clean needles, then there's a very good chance that they're going to have HIV or Hep C at some point. The work that I do has seen me do, I do what I call online outreach. There's many internet forums where people go and opiate users share stories, and I go on there and educate people, and I try and get people in contact with places where they can access clean supplies. And one of the things that I see every day is a lack of access to clean needles. And when people can't access them, or when there's laws that prevent them from carrying them, what tends to happen is that they use the same needle over and over again, or they'll share a needle. And I feel that at the moment we have this generation of young injecting drug users who weren't there at the dawn of the HIV epidemic. And those people don't necessarily know the risks of injecting drug use, particularly the Hep C and HIV risk. And if we don't fund those grassroots organisations, the services that are on the front line, then we may very well be looking at another HIV epidemic. And that's something that I very much do not want to see. But I thank you for your time, guys, and I'll be in contact later. Thank you.
Thank you very much. And again, if anyone would like to provide written testimony, we'd be very happy to take that. I'm told that we have another speaker, and that is Mr. Anthony Rizzuto from FIST. No? Yes? Okay.
Thank you, Senators. Thank you for doing this. And thank you for the opportunity. When you're up here, number 27, there has been so many really good things said, a lot of the stuff that we would have said. So I'm going to try to maybe touch on some things that weren't said, just emphasize something that was. So, this is not a simple solution. This is not a single problem. It's a multi-pronged problem, and it requires a multi-pronged answer. I'll start off by saying that people that struggle with the disease of addiction aren't bad people. They're sick people that need help. Let me just put that out there. When we're dealing with addiction, I think the first thing I got to take a look at is accessibility to the drug. I had somebody say the other day, why is it so easy for me to get dope and so hard to get recovery? Why is it that I can't get into treatment? So to me, the accessibility piece to the drug, and I heard Commissioner Cini, and I'm really glad to hear the different things that they're going to do, but I think one of the areas that I didn't hear spoken about, and I would encourage you to take a look at, is online. I mean, I can't tell you how many people I've heard go online, where can I get drugs? Where can I get heroin? We have to take a look at that and do better. Craigslist, people going on. That's one area. So the accessibility to drugs. The second part I would say is the prevention. In the area of prevention, you know, putting a crashed car out in front of a school is not prevention in and of itself. Not a bad idea, but in and of itself, it's not going to get where we need to get. Jeff Reynolds talked about some good stuff. What I would say is something to think about, a couple of things. I recently did a piece for a German TV station, and they told me that in Germany, they only prescribed opiates and opioids for end of life and for cancer. And when you look at how easy it is over here, and they also talked about not allowing them to put commercials on TV for opioids, something to consider. What our kids are exposed to, when we talk about prevention, besides curriculums coming into the school, what our kids are exposed to, what they get to see on TV, I think is very influential to them. So I would consider something along those lines. Also, I would say that in regards to treatment, I'm a person that works in the treatment field. I'm a credentialed alcohol and substance abuse counselor, and I'm a licensed social worker. And what I'll tell you is that it is sad that when a person finally comes to the point, and they don't get there easy, about, all right, I'll go, I'm ready to get help, just to hear that you can't get them in. And I'm one in the know. I'm someone who's connected. I'm someone who can make phone calls and know the directors of all the programs. So what happens to the average mom of the 19-year-old that finds a syringe in the drawer? How do they navigate the system? So I would say that there's a couple of things that need to happen. First, bed availability needs to increase. The amount of beds that we have, that has to increase. Tony DeFelice talked about the crisis centers. Maybe that could be something that we can take a look at that could plead, kind of like Mercy New Hope in Nassau County, where they gave asset forfeiture funds to be able to do 24/7 admissions, which they're already doing at Talbot House, but maybe even being able to expand it. You know, a lot of us are doing this work. I'm the executive director of FIST. We're all volunteers. And we do everything we do with zero money from county, state, or government. And that's okay. You know, for a while, it's okay. As long as I don't burn everybody out. I got an advisory committee, and I'll tell you what, I have about 10 or 15 moms and dads that lost their kids that roll up their sleeves and say, what can I do? They want to be the part of a family navigator. I know somebody, and we get people connected with peer support. In terms of the treatment, I'll tell you one of the biggest issues that I see, who's going to pay for it? The insurance companies, they're denying people left and right to be able to get either detox or either get rehab. If it's painkillers or heroin, most of the times you're being denied. And when you do get approved, they're giving you limited time. You've heard mentioned from a few other people. In the past, when a person was addicted to heroin, we were giving them somewhere between 8 to 18 months worth of treatment. Now, when we get a person into rehab, at 5 days, they're starting to talk about put them in outpatient and put them on Suboxone. That's pathetic. We're dealing with one of the most powerful drugs in the world that people are addicted to today, and we have such limited time to be able to work with them. So I would say that in the area of treatment, we had gone for PA Act 106 last time around. We did, with the help of Senator Boyle and the Senate, we did get 11 bills passed, and it has made a difference, but nowhere near where we need to be. The fact that so many people are waking up, you know, with one child missing in their home, we are failing, and this is unacceptable. We can't continue to do this. And I know I'm kind of preaching to the choir, because you guys have done some really good stuff, but the fact of the matter is that change has to happen. And when we can't get people into treatment, and when we can't keep them in the treatment, I think that we have a problem. The results speak for themselves. I'm just going to fly through some last things. In the area of recovery, you heard Steve Chasman talk about the high schools and the colleges. I have 2 kids. My son was doing great. Goes to college, he's exposed to all this stuff. Why do I got to deal with that? Why is it that, you know, while they're under my roof those first 18 years and we got a hold on them, and then we send them away to school, and they're infested the schools. So I think that there should at least be some options for people that did want to take make a choice to go to a high school that was a sober high school or a college. Lastly, I'll talk about, to me, what is true and dear to my heart is the families. You know, we've never really looked at, we take a family system where addiction is active, and we identify the patient and we send them away to be fixed. Meanwhile, the family had been living with active addiction for the last 10, 15 years. That whole family needs to recover. But what do? We take the person, we send them out to get fixed, and then we bring them back into that same systems. I'm going to encourage the fact that we take a look at providing services for families, because the reality of it is the family work that I've been doing, I can tell you that there is no guarantee that when a family goes through their own recovery, that the identified patient is going to recover. However, their life gets better and their odds improve. That's what I'll tell you. Thank you for your time.
Thank you. And we have our last two speakers to wind up are going to speak together. That's Linda Ventura and Kim Rivera.
Linda's not here, so I'll
Okay, very good.
I just wanted, my name is Kim Revere. Hi, Kings Park in the Know, and Fist. I have just a suggestion, because I do belong to Communities of Solution too. We have that resource list, the OASIS approved list. I made a suggestion to the police commissioner's office. I thought that it would be a really great idea to have that list available in every police precinct so that anybody who needs it can just walk into a police precinct. But I also believe that it needs to be available in emergency rooms of every hospital, because I know as a parent myself, my son used for 10 years and he's got, Thanksgiving was 1 year clean, he's doing wonderfully. However, I remember being that parent, like not knowing where to go. And I've worked for the county, I work for DSS, but if there was something in that way, just they could walk into an emergency room, they could get the list, and more important, they could have that number to LICAD, they can make that telephone call, and boom. That would be so easy.
Okay, thank you. Good idea.
Thanks, Tim.
Sir?
Yes, good afternoon. I'm Ira Costello of Port Jeff Station. I'm also on the Family Advisory Committee of FIST, Families in Supportive Treatment, that Anthony spoke about. First of all, I'd like to welcome you here, Senator Murphy, Senator Ort, and you as well, Senator O'Mara, coming all this distance. We appreciate it. This way, save us one less trip to Albany to come knock on your doors. But we'll be back anyway, because sadly, this problem is not going away. As Dr. Reynolds, so articulately put it, it's getting worse. It really is. Just yesterday, somebody I know in recovery, reported 2 friends just yesterday on the heels of being at a wake of a young man who was found, behind a shopping center. Maybe not directly an overdose, but an overdose death in my book, because he was unfortunately caught up in the disease of addiction. And that's what we're talking about here. As significant and profound as this disease is, or heroin and opioid epidemic is severe, we are talking about the disease of addiction. And we are talking about something that's going to require, a multiplicity of approaches. And I know a lot of the gentlemen on the stage here have been making that effort. And as Anthony said, I don't want to preach to the choir, nor do I want to talk too much about the problem, because we know about it. We know about it all too well on Long Island. Literally every single day, an additional family wakes up and belongs to the club that FIST started, families in supportive treatment, people who are seeking help, but also have lost loved ones. Every single day we have 350 overdose deaths between Nassau and Suffolk County. So we know this problem all too well, but what do we do about it? Well, we know some of the things you have done. We have, employed the Good Samaritan 911 bill. We've passed iStop. We've done a lot of good things, but there is much more to be done. I don't want to take too much time. I'm mindful of how long we've been here today, but I do want to come up with a couple of ideas, perhaps echo a few that have already been mentioned, but throw out a couple of new ideas that I've been thinking about and see if they kind of run them up the flagpole and just kind of food for thought. First of all, just in general as an overview, the OASIS budget is literally just 2/3 of 1% of the entire operating budget of the state of New York. I'm a taxpayer in this state. Everybody you see here is a taxpayer. We know this problem. If the governor and the state senate leader and the assembly speaker have identified this as a crucial aspect that they want to address, I dare say 2/3 of 1% of the state operating budget does not identify this as a priority in this state. And I demand on behalf of all the people who have lost loved ones, including myself, in the memory of my nephew, David Aaron Costello, who passed from this disease 9 years ago, we need to do more. We're obliged to do more. And the fact of the matter is, we can do more. So how do we make that more of a priority? First of all, I appreciate the $25 million that you appropriated this year as additional funding, but we can and we should and we need to do absolutely much more. totally on the 72-hour hold. I mean, I was contacted 5-6 years ago. I contacted Senator LaValle's office and talked about the Marchman Act in Ohio, in Florida and Ohio, where they have 5 days, not even 3. But we have to make hospitals accountable. When we bring somebody in, as you aptly put it, Narcan is simply triage. We are dropping the ball, and we are perpetrating an absolute horrible future for people, sending them back onto the streets without anything. I have some heart condition issues. If I went in today with some chest pains, there's not a hospital on Long Island that would refuse me treatment or say, gee, you need to be sicker. I don't see you turning blue yet. Okay? They're going to take me in, they're going to hook me up on machines, and they're going to see what they can do for me. I've had people who are literally in the throes of, because they're not in withdrawal, they go out and use, but they still want help. So a guy says to me, he's high. Can you take me to a place? Can I go to a detox center? I'm saying no. And somebody mentioned here, I don't know if it was Chasman mentioned you get flu-like symptoms. Well, you're not going to die from it. You only wish you could. I ask any of the gentlemen on the stage to find, to go and experience somebody who's dope sick. It is horrible. It's not flu-like symptoms. You'd rather jump off a building or drive nails through your forehead. So this is something that we have to show compassion to people. If they want to help, we need treatment on demand in this state, period, end of story. Just a couple of things. Terry Kroll couldn't be here today. She was here earlier. She had an idea that we discussed in Senator Murphy's office along with Senator Ort about the idea of having the Department of Health distribute and issue health proxies to hospital rooms and to other places where if you come in for a Narcan revival or in some of these Narcan trainings, if you have a child who is clear-headed enough and they're willing to sign over a health proxy, because when they're active and they're using, they're not going to give you that opportunity. But if you get them while they're, somebody's intervening, that's something that could be done. And I know we discussed it, and Terry wanted to talk about it today, but she had to go back to work. Sober high schools, absolutely. Massachusetts is 1/3 the population of the state of New York. They have 5 sober high schools in Massachusetts. We have 1 that's just done on a private rehab center. It's not even a public education facility. So we have 0 for 19 million people. That's just insane that we can't make that a project through BOCES and fund that. The other idea I had is, I hate to talk technical, but, the OASIS is working with trying to employ SBIRT, which is screening and brief intervention and treatment evaluations through the hospital systems of New York State. We need to demand that all hospitals employ that process. And I think we should require that school nurses are trained in SBIRT. And I know I'm a little old, I'll date myself, but I know for physical education, we used to have to see a doctor on a yearly basis just to go through PE, and they would do an exam. So not even the most pleasant of exams, but if you remember. But nonetheless, school nurses should be trained in SBIRT, and we should have an evaluation process on a yearly basis. Every year, every child should be screened so that we can have that early intervention. I think we ought to have drug courts in every county in this state. Every county ought to find a way to fund a drug court, because it is sometimes the first line of intervention for people to get into recovery. This is not a criminal justice problem. We're not going to arrest our way out of it, but it does have a role to play, along with what the sheriff does in Massachusetts. I know in Albany, they've started a program where the sheriff there tries to connect people to treatment immediately. Doesn't arrest them, gives them the option to go right into treatment. We need to expand those things. 1 or 2 last things. I'll take this offline later, but I'm concerned about the passage of Senate Bill S6778 and 6779, which passed 59-2. And this was a law that would allow nursing homes to be exempt from the e-prescribing system. And it was also a bill that would allow doctors who prescribe 25 prescriptions or less of opioids to be opted out of the e-prescribing. I think there were a lot of implications, which I've written up, that people didn't recognize. What I'm most concerned about is that there was not a proper dialogue between us. I'm asking you to take the message to Senator Amador that we need to have, you guys have been on our side big time for years now, but the same Senate that passed prescriber education 61-0 came back and passed a bill that kind of doesn't help the situation. So not only am I concerned about the bill itself, which I believe the governor is going to veto, I'm concerned that we kind of didn't have the communication or recognition that the alcohol and substance abuse people should have been in on this, and our groups, all the stakeholders, should have been included in this process. And we really need to team up together as we've been doing. So I'm concerned we kind of missed the mark on that one. And then finally, just the last concept I spoke with Bob Lindsay about today. Yes, we do need to make the budget an important part of your priorities and what we can spend in the state, but I'm also mindful of the fact that we collect millions of dollars in this state through the bottle law that gives us a nickel on every soda can and bottle that we have. And that creates a funding stream that's important to protect the environment, you know, the environmental fund that we finance. We need to find a funding stream that will finance more beds, that will give more intervention, that will have community centers. And I have just a passing thought, which might have some problems, but, you know, why are we not having a half of a penny on every vial that we distribute across this state? There's millions and millions of these vials that need, you know, that we can kind of bring some money in and also have a reclaim process that would, you know, allow the pharmacy companies to also contribute to bringing back the medications and not putting it on the police departments or me to come in and do that, but to somehow connect the pharmaceutical companies, which are making billions of dollars. The reality is the United States of America has 5% of the world's population, but we consume over 80% of the opioids. How is that not a problem? And that just winds up the final point. We need to pass prescribers' education, despite whatever the opposition is of MSNY and some of the other organizations. But thank you for listening. And
Thank you very much. So we have been here for 3 hours, 3+ hours. And I think we could go on for another 3+ hours because listen, it's something we deal with in our daily lives. And for somebody like me, first, I'm proud to sit on the dais today with my colleagues in the Senate who, but for their intervention, particularly the chairs of the task force, there would not have been this level of funding in the state budget this year. I think the proposal by the governor was an additional $6 million, and we were able to get that far and above, and we will continue to press next year and the year after that and the year after that. We have sharp elbows, and we're not afraid of a fight. And this is a fight of our lives. So, Senator Murphy, Senator Ort, thank you for coming down and bringing the task force to us. Senator Boyle, Senator O'Mara, I can't tell you how much it means to have you both here. I'll end on this. Most kids, when they were little, in their teens, got to go to Disney World. When I was a kid, I went to detox centers, locked wards, treatment facilities all over the East Coast and the West Coast because of my family's involvement in this. One of the things that I remember most profoundly was one conversation with Dr. Ernest Noble, who in the late 80s and 90s discovered the pleasure gene, the A1 allele of the GABAR gene, which is what we call the gene for addiction, and developed a DNA test kit for it. And what I learned there is there's some people who look at a piece of art or listen to a piece of music and they are moved by it. They have a movement in their body. They are truly impacted by that. And there are other people who don't. And the people who don't, who have a deficit of that pleasure gene, tend to be the ones who have trouble with addiction. And these are inherited traits. And these are inherited genes. Our goal today in bringing the task force here is to recognize that this is a respectable and treatable disease. As I said when we started, if I were to ask who are the diabetics in the room or the cancer survivors, I think there would be people who would get up and be very proud that they are. If you are in recovery, you should not only be proud that you're in recovery and cherish every day of your recovery, but you should also know that you have strong arms around you, both at the elected level and at other levels. And then I'll end with this. Bill Wilson, who many in recovery know that name, did a recording. This is the other thing I got to do when I was in my teens, is listen to recordings of Bill Wilson. And he said that the hope for the alcoholic, he was talking about the alcoholic and the addict, I would extend it, there is great hope because, again, the same mind that has this propensity for addiction also has the treatment. It requires honesty and went on to 12 steps. But he also said there is a very slim population that will not get well. And that is because they'll never achieve that honesty. And that honesty is so important in recovery, but the honesty is also important in the community to recognize that we have a problem and that we need to confront it. And I appreciate you being here to be part of what I hope is a solution in the years to come. Thank you very much.